Dina, our reporter, went to visit Dr. Fakih at one of the leading IVF clinics right here in Dubai. Just take a look at this.
With over 25 years of experience, Dr. Fakih is recognized as the leader in the field of assisted reproduction. His effort and innovation of new techniques has made him a blessing to many couples in Dubai. Hi, Dr. Fakih. So what percentages of couples in Dubai have difficulty conceiving?
It's about 7%.
What are the main reasons for this?
Well, stress is one of them, but there's many other factors. One of them is the most prominent in women is polycystic ovaries. And this has to do with some genetic issues, plus mainly sugar intake. A lot of carbohydrate intake. You have male factor, that's probably 50% of the causes will be from the male.
What is the success rate?
Time is extremely important because success rate really goes down after 35 with whichever method you use. So if you're younger, then you can probably wait 1 or 2 years, but at least do a sperm count because it's a very simple test. It takes only like 1 hour to get the result and it'll give you an answer like 50% of the causes. If you're having issues with your cycle, then go to the doctor, have them fix it and make you ovulate. If you ovulate for like 1 year, sperm is fine, not getting pregnant, then you should seek further treatment.
How long does the entire IVF procedure take?
It takes about 3 weeks from the day we start medications till the day we transfer the embryos.
How long after the embryo is transferred back into the patient's uterus will a woman or a couple discover if they're pregnant?
10 days.
Okay, Dr. Mohamad, so I believe this is where the eggs are retrieved from the patient.
Yes, this is the operation room. The patient, when she's ready for the IVF, the eggs are retrieved in this room. The doctors will use ultrasound guidance to collect the eggs from the patient. The fluid will be collected in tubes, and the tubes will be given to the embryologist in the embryology room. So once the oocytes are collected in tubes from there and I receive them here, I look into the eggs under the microscope and wash, after I found them, wash them in special media and then put them in the incubator. Once the eggs are cleaned from the cumulus cell that surround the egg itself, then the eggs are ready for insemination. And this is the ICSI machine. ICSI means intracytoplasmic sperm injection, where a single sperm is taken in this injection needle, and this is a holding needle to hold the egg in the place, and then we go in this injection needle inside the egg, release the sperm.
Well, that's fascinating. So this is actually where you would have the sperm and the egg and you would actually implant them. Now, if you're transferring 3 embryos into the uterus, is there a risk of multiple pregnancies?
Yes.
There definitely is a risk.
Yes.
How often does it happen, multiple?
Like the twin pregnancy is higher if you put back 3, and the triplet is also, there's a chance like probably like 5 to 10% of triplets. This is the freezing room where we freeze the extra oocytes and the sperm, and these are the storage tanks.
Sometimes life doesn't happen the way we expect it to. But when it comes to having a family, well, that's one dream you should never give up on. And as we've seen today, with the help of a bit of technology, a fading dream can become a reality.